Other things include iodine deficiency, which is really, really rare in the United States, where you have iodized salt available. But in many parts of the world, it still is a problem because of the iodine deficiency in the diet. Okay, you cannot produce enough thyroid hormone because iodine is one of the substrate where thyroid takes in to create that hormone. So drugs are pretty common as well. Lithium is one of them. In the old days, they used to use lithium a lot to control mood disorder like bipolar. Lithium has many side effects, and rarely nowadays they're using it. Okay. And as you can imagine, developmental, where you're born with deficient thyroid gland, you cannot produce enough hormone or radiation. Who has had head and neck cancers of some sort, and went through radiation of your head and neck area, that can produce some amount of damage to your thyroid gland as well. And those conditions, you cannot produce enough thyroid hormone. And of course, surgical. If you take part of your thyroid out for some reason, like lumps or whatever, you can have deficiency of your hormone production as well. Okay. Let's go on and talk about clinical features. Okay? What your body will show, what signs and symptoms your body will show if you don't have enough thyroid hormones. Okay, so if you remember the first page of what your thyroid gland does for your body, that makes you go. Okay, that's a keyword. So if you don't have enough thyroid hormones in your body, what happens? Everything slows down. Okay, that's a general term you can remember. So if you go down and read your physical and mental activities are slowed down. Okay, you feel fatigue. You have lethargy. You have cold intolerance. You're apathetic. Your speech has become slow. Your intellectual functions are not as sharp. You decrease sweating, your bowels don't move as good, so you become constipated, and your metabolism slows down, so your weight gains. Sometimes in the women, you can have menstrual irregularities as well. Okay? If that goes on, and if we don't correct that thyroid problems later on, you can have edema. You tend to collect fluids inside your skin. You have edema. Your heart becoming enlarged. Your motor function slow down and things like that. And also, your cholesterol can be elevated for that reason as well. So those are some of the findings you will find on your body. Okay. So we talk about how thyroid hormones production is regulated inside your body. So we always start with the blood work. Okay, if we suspect somebody is having problem with the thyroid, okay, it's called TSH that we talked about on the first page. So if you remember, that's opposite. Okay, if your thyroid hormones is low, your TSH is high. So that's how we diagnose it. We do the blood work, found TSH is very high. We can say, yeah, your hormones is not produced enough. Okay. Sometimes, in addition to the blood work, if we feel your glands is enlarged, you may have lumps in your glands, we may probably order some ultrasound, okay, to try to see what those abnormalities in your thyroid glands are. And sometimes, if you find a cyst or an area which is not normal, we may probably go ahead and do like a needle biopsy to try to rule out usually replacing with synthetic thyroid hormones because your body is not producing enough thyroid hormones anymore, so we have to give extra with the medication. You might have heard about Synthroid, Lavoxal, and those kind of medications. And we monitor that TSH periodically so that we can adjust the dose. Okay? If TSH is still high, that means we're not giving you enough thyroid hormone. So we increase the dose, and if your TSH is lower, then we back off on your doses. Okay, so we check TSH for those of you who are on those thyroid hormone replacement. When you're taking those thyroid hormone replacement medicine, you don't want to be taking it together with calcium, iron, and fibers, and sometimes antacids because they can decrease the absorption of those thyroid medicines from your stomach. Okay? So we've gone through hypothyroidism, which is low thyroid hormone production, okay? Which is much more common disorder than the next one we're going to talk about, which is hyperthyroidism. Your thyroid is producing more than normal amount of hormones. Okay, so let's go through what are the conditions that can cause your thyroid hormones to be producing more hormones than your body is needing. So, Graves' disease. Graves' disease is also an autoimmune disorder, meaning that your body produces an antibody to the thyroid glands, and it stimulates the thyroid glands to be producing more hormones. Okay, that's the most common causes of hypothyroidism. And the other two, you have nodules in your thyroid glands sometimes, and those nodules can be producing more hormones. So three of those combined causes 99% of the cases of hyperthyroidism. Okay, going down on the list are some of the rare disorder, thyroiditis. If you sometimes have thyroid cancers, they're producing more hormones and cause those problems. Sometimes ovarian lesions. You might have heard about some ovarian mass, producing thyroid hormones and causing thyroid problems. And iatrogenic is always a problem, that doctors giving you too much medicine. So let's go ahead and talk about the clinical features, okay? What your body can present with when you have high amount of thyroid hormones. So exact opposite of what you will find on the first case, low thyroid hormones. So let's go ahead and read. Heat intolerance. You're going to have weight loss because your metabolic hormones is increased and your body metabolism is increased. So those are the findings that you will find on your body. Weakness, tremors, increased sweating, your heart rate is small, palpitations, you'll feel anxious. Sometimes atrial fibrillation is one of the most common conduction disorder of your heart, and that can be associated with hyperthyroidism if you're having more thyroid hormones in your body. Okay? So as opposed to constipation, your bowels move more, so you have frequent bowel movement. The picture that I put in there, staring at you, you don't want to look in the night. It's called proptosis, okay? And you can have those findings when you have Graves' disease. Your eyeballs is popped out of your socket, and that's common finding in Graves' disease, okay?